Bloodborne Pathogen Standard, OSHA training video. The purpose of this training video is to ensure awareness and promote safety among employees who may be exposed to bloodborne pathogens. The goal is to ensure that employees operate in the safest possible manner in situations where contact with potentially infectious material is likely. At the conclusion of this training video, the individual will know what bloodborne pathogens are and how they are spread, learn the importance of the exposure control plan, know what to do in case of accidental exposure, use appropriate safety methods and work practice controls, recognize signs and labels that are used to alert personnel of danger involving infectious materials. In 1990, the U.S. Occupational Safety and Health Administration estimated that occupational exposures to bloodborne pathogens caused more than 200 deaths and 9,000 bloodborne infections every year. OSHA published the Occupational Exposure to Bloodborne Pathogens Standard on December 6, 1991. The purpose of this standard is to protect workers by limiting occupational exposure to blood and other potentially infectious materials. In 2000, the Needle Stick Safety and Prevention Act, which revised the bloodborne pathogen standard to address the implementation of safer needle devices. This revised standard, which included new requirements such as the use of safer needle devices and maintaining a log of contaminated needle stick injuries. The revised standard became effective in 2001. The Bloodborne Pathogen Standard is located in Title 29 of the Code of Federal Regulations, Part 1910.1030. What are bloodborne pathogens? Bloodborne pathogens are microorganisms that are present in human blood and can affect and cause disease in people who are exposed to blood containing the pathogen. These microorganisms can be transmitted through contact with contaminated blood and body fluids. Bloodborne pathogens include, but are not limited to, human immunodeficiency virus, which is also known as HIV, hepatitis B, which is short for HBV, hepatitis C, HCV, and non-A, non-B hepatitis. In this video, we will go over the exposure control plan, methods of compliance, universal precautions, engineering and work practice controls, personal protective equipment, housekeeping, regulated waste, laundry, the hepatitis B vaccination, what will happen should there be an exposure, communication of the hazard to the employees, information and training, record-keeping requirements, training records, and Sharp's injury log. The exposure control plan must identify jobs and tasks where occupational exposure to blood and other potentially infectious materials occur. That plan must be in writing, reviewed annually, and is reviewed for safer medical devices. Have input from non-management employees and is accessible to all employees. Methods of compliance. The Bloodborne Pathogen Standard specifies methods that are used to minimize the transmission of bloodborne pathogens in the workplace. Engineering and work practice controls. These are the primary methods used to control the transmission of HBV and HIV. Engineering controls. Examples of those: Sharp's disposable containers, self-sheathing needles, safer medical devices as in Sharp's with engineered Sharp's injury protections, and needleless systems. Universal precautions is the approach to infection control. All human blood and certain body fluids are treated as if known to be infectious for HIV, HBV, and other bloodborne pathogens. Work practice controls include washing hands after removing gloves and as soon as possible after exposure. Do not bend, recap, or break Sharps, and there is to be no food or smoking in the work areas. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against a hazard. An example of those would be gloves, gown, face shields or mask and eye protection, mouthpieces, resuscitation bags, pocket mask, or other ventilation devices. Housekeeping. Employers shall ensure that the work site is maintained in a clean and sanitary condition. Contaminated work surfaces shall be decontaminated with an appropriate disinfectant. Regulated waste is contaminated items that would release blood or other potentially infectious materials in a liquid or semi-liquid state if compressed. It must be placed in closable, leak-proof containers built to contain all contents during handling, storing, transporting, or shipping and be appropriately labeled or color-coded. Contaminated laundry shall be handled as little as possible, and the worker must use personal protective equipment. Contaminated laundry shall be bagged or containerized at the location where it was used, placed, and transported in bags or containers labeled or color-coded. Hepatitis B vaccination. The employer shall make available the hepatitis B vaccine and vaccination series to all employees who have occupational exposure, and post-exposure evaluation and follow-up to all employees who have had an exposure incident. What must be done with a post-exposure? Document routes of exposure and how the exposure occurred. Record injuries from contaminated sharps in a sharps injury log. Obtain consent from the source individual and the exposed employee and test blood as soon as possible after the exposure incident. Provide risk counseling and offer post-exposure protective treatment for disease when medically indicated in accordance with current U.S. Public Health Service guidelines. And provide written opinion of findings to employer and copy to the employee within 15 days of the evaluation. Communication of hazards to the employee. Those are warning labels which are required on containers of regulated waste, refrigerators and freezers containing blood or other potentially infectious materials, other containers used to store, transport, or ship blood or other potentially infectious materials. Red bags or red containers may be substituted for labels. Information and training. The employer is to provide training at no cost to the employees during working hours. That training has to be at the initial assignment to a job with an occupational exposure and at least annually thereafter. Additional training is needed when an existing task are modified or new tasks are required which affect the worker's occupational exposure risk. Those records must be maintained for 3 years. The training program for the employee must have a copy of the standard and explanation of its contents, mode of the transmission, site-specific exposure control plan, hazard recognition, use of engineering controls, work practices, and personal protective equipment, and an opportunity for interactive questions and answers with the person conducting the training session. Record-keeping requirements for an exposure. The record has to include the employee's name and social security number, employee's hepatitis B vaccination status, results of the exams, medical testing, and post-exposure evaluation and follow-up procedures, the healthcare professional's written opinion, information provided to the healthcare professional. The employee medical record must be kept confidential and not disclosed or reported without the employee's written consent. And those medical records must be maintained for the duration of their employment plus 30 years according to OSHA's rule governing access to employee exposure and medical records. The training records shall include the following: the dates of training, the contents or a summary of the training sessions, the name and qualifications of persons conducting the training, the name and job titles of all persons conducting training sessions, and training records shall be maintained for 3 years from the date on which the training occurred. Sharps injury log. Employers must maintain a Sharps injury log for the recording of injuries from contaminated sharps. The Sharps injury log must be maintained to ensure privacy and at least have the type and brand of device involved in the incident, location of the incident, and description of the incident. And in conclusion, even the most comprehensive exposure control plan cannot guarantee that no accidental exposures to bloodborne pathogens will occur. Unplanned circumstances can expose the employee to a bloodborne hazard. Therefore, it is important you have a plan in place to minimize the exposure and reduce the chance of disease transmission.